Most people think bleeding gums are harmless. A little blood while brushing? No big deal, right? But what if your mouth was quietly sending a warning here?
A warning about your heart, your blood sugar, even your brain? Right now, millions of people are walking around with gum disease without realizing the bacteria inside their mouth may already be traveling through their bloodstream.
And some scientists now believe your gums could influence your risk of heart attacks, strokes, diabetes, and chronic inflammation throughout your body.
We're going deep inside the human body to reveal the terrifying connection between your mouth and your survival.
Your mouth contains billions of bacteria. Some are harmless, some are helpful. But when food particles stay trapped between your teeth, especially sugar, harmful bacteria begin feeding and multiplying. They create a sticky layer called plaque. At first you may notice nothing. Then slowly your gums become irritated. They turn red, swollen, sensitive, and when you brush your teeth, they bleed. This early stage is called gingivitis. But if it continues untreated, things become far more dangerous. Gums, making the tissue and bone that hold your teeth in place. When your gums bleed, tiny openings form in the tissue. That gives bacteria direct access to your bloodstream.
Every time you chew, brush, or floss inflamed gums, bacteria can escape into your circulation. Your immune system immediately reacts. White blood cells attack. Inflammation spreads. And although inflammation is meant to protect you, chronic inflammation slowly damages healthy tissue too, including the walls of your arteries. This is where things become frightening. Researchers discovered that people with severe gum disease often have a higher risk of cardiovascular problems.
The theory is alarming. When bacteria and inflammation damage artery walls, fatty plaque builds up more easily. Over time, arteries become narrower and harder. Blood flow decreases. The heart must work harder and harder just to survive. Then one day, a clot forms. Blood supply gets blocked, and suddenly, a heart attack happens. Gum disease alone, but it may silently increase the risk. The connection between gum disease and diabetes is even more shocking. High blood sugar weakens the body's ability to fight infection. That means diabetic patients often develop worse gum disease, but it also works the other way around. Severe gum inflammation may make it harder for blood sugar levels to rise even higher.
It becomes a dangerous cycle. More inflammation, more blood sugar problems, more damage throughout the body. And researchers are now studying possible links between gum disease and other serious conditions too, including memory problems, dementia, lung infections, pregnancy complications, and chronic inflammatory diseases. Even your skin can reflect internal inflammation. Your immune system stays under pressure. Energy decreases. And over time, the entire body feels the effects. These warning signs should never be ignored.
Bleeding while brushing, persistent bad breath, swollen gums, loose teeth.
Pain while chewing, receding gums. Your mouth may be trying to tell you something long before the rest of your body breaks down. The good news is that gum disease is often preventable. Brush twice daily, floss regularly, reduce sugar, stop smoking, drink more water.
And most importantly, don't ignore dental checkups. Sometimes protecting your heart starts with protecting your gums.
Your mouth is not separate from your body. Every small habit, every ignored symptom, every drop of blood in the sink could be telling a much bigger story.
And if you learned something important today, kindly subscribe to Dr. Square Animations for more powerful health animations.